Hi everyone, welcome back to my YouTube channel, and today we are going to talk about fungal infections. So let's start our topic with introduction. Fungal infection, also known as mycoses, are diseases caused by various species of fungi. These organisms exist widely in environment and may be harmless, beneficial or pathogenic. Fungi can infect the skin, nails, mucous membrane and internal organs. While many fungal infections are mild and superficial, some can become severe, especially in individuals with weakened immunity. Fungal diseases are classified based on depth of infection and type of pathogen involved. Characteristic of fungal infection. Fungi are eukaryotic organisms that include yeast, mold, and dimorphic fungi. They reproduce those spores which can spread easily in environment. Fungi lack chlorophyll and depend on organic matter for nutrition. They have thick cell wall containing chitin which provides rigidity and protection. Many fungi normally live on human skin and mucosa but may cause infection when conditions favor their overgrowth. Classification. First is superficial mycoses. These are infections that affect outermost layer of skin and hair. They rarely cause inflammation and are mostly cosmetic. Second is cutaneous mycosis. These infections involve keratinized tissues like skin, hair, and nails. They are commonly caused by dermatophytes like trichophyton, microsporum, and epidermophyton. Third class is subcutaneous mycosis. These are infections that occur deeper in the skin and subcutaneous tissue. They often arise following traumatic implantation of fungal spores into the skin. Fourth classification of fungal infection is systemic mycosis. These infections affect internal organs and may be life-threatening. They are usually caused by dimorphic fungi like Histoplasma or blastomyces. Fifth classification of fungal infection is opportunistic mycosis. These infections occur in people with weakened immune system, such as patients with HIV, cancers, diabetes, or those taking immunosuppressive drugs. Common organisms in this group include Candida, Aspergillus, and Mucor species. Common types of fungal infection. First is dermatophytosis, that is also called as ringworm. Ringworm is contagious fungal infection that affects skin, hair, and nails. It appears as circular patches with raised, itchy borders. Variants of this include Tinea corporea that affect body, Tinea capitis that affects scalp, Tinea pedis that is also called as athlete's foot, and Tinea ungonium that affects nail. Second common type of fungal infection is candidiasis. It is caused by Candida species, especially Candida albicans. It can affect the mouth, causing oral thrush. It can cause skin folds, nails, and it also affect genital regions. Vaginal candidiasis is common in women and present with itching and thick white discharge. Third type of fungal infection is aspergillosis. It is caused by Aspergillus species. This infection commonly affects the lung and it may cause allergic reactions like fungal ball in the lung or invasive disease in immunocompromised individuals. Fourth common type of fungal infection is mucormycosis. It is severe and rapidly progressive infection that is caused by mucor and rhizopus species. It affects the sinuses, brain, and lungs. It is seen mostly in diabetic patients or those with suppressed immunity. Fifth common type is histoplasmosis that is caused by Histoplasma capsulatum, that is a dimorphic fungus found in soil and contaminated with blood or bed dropping. Inhalation of spores lead to lung infection and systemic involvement in severe cases. Pathogenesis of fungal infections. Fungal infection begins when spores or fungal cells come into contact with skin, mucosa, or are inhaled into the respiratory tract. Factors that make an individual more prone to fungal infection include warm and humid environment, poor hygiene, prolonged use of antibiotics, diabetes mellitus, immunosuppression like in case of HIV, cancer therapy or organ transplantation. Once inside the host, fungi multiply and may produce enzymes that break down host tissue. Some fungi invade deeper tissue or disseminate through the bloodstream. Clinical features of fungal infection. Symptoms vary depending on the type and location of infection. If it is superficial or cutaneous mycosis, it can cause itching, red or discolored patches, scaling or peeling skin, brittle or discolored nails. If it is subcutaneous mycosis, it can cause nodule under the skin, ulcerative lesion, chronic inflammation. If it is systemic or opportunistic mycosis, it can cause fever, cough and breathing difficulties, fatigue, weight loss, and organ-specific symptoms depending on spread. Diagnosis of fungal infection. Diagnosis of fungal infection involves a combination of clinical evaluation and laboratory tests. It includes microscopy, that is potassium hydroxide preparation helps visualize fungal hyphae or yeast cells. It includes culture as fungi can be grown on seborrhoeas, dextrose, agar for identification. We can also do histopathology, in which biopsy samples may show fungal elements in tissue. We can do serology and antigen tests, that is useful for systemic infections such as histoplasmosis. We can also do imaging like CT or MRI that may be required for deep or invasive fungal infections. Treatment of fungal infections. First we do is antifungal medication that include topical antifungals like clotrimazole, miconazole and terbinafine. We can also do oral antifungals that include fluconazole, itraconazole and terbinafine. And systemic antifungals that include amphotericin B, voriconazole and posaconazole. And then there is symptomatic management of fungal infection that include maintaining good hygiene, keeping skin clean and dry, avoiding irritants, and then there is surgical intervention that is done in severe cases like in case of fungal ball or mucormycosis. Surgical removal of infected tissue may be necessary. Prevention of fungal infection. Preventive measures for fungal infection include keeping skin dry and clean, wearing loose-fitting clothing, avoiding sharing personal items like towels or shoes, controlling diabetes, and by using antifungal powders in moist areas, and strengthening immunity through a healthy lifestyle. Conclusion of this lecture video. Fungal infection range from mild superficial condition to life-threatening systemic diseases. While many are easily treatable, early diagnosis is critical to prevent complication. Good hygiene, proper health practices, and timely medical care play a key role in managing and preventing fungal infections. Understanding different types, causes, and treatment of fungal diseases help improve patient outcome and reduce their overall impact on public health. And this was all about fungal infections. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.